types of plastic packaging used for healthcare applications, their essential role in protecting medical devices and pharmaceutical products, and the stringent regulatory landscape that must be navigated. The prevalence of plastic packaging in the healthcare industry has led to the emergence of plastic waste management as a critical concern for healthcare administrators. Collaboration and technology advancements will be paramount to transforming how healthcare facilities handle plastic waste. This lesson, we're going to delve into the barriers, solutions, and collaborations shaping the future of healthcare plastic recycling. Healthcare facilities generate substantial amounts of waste. According to the Healthcare Plastics Recycling Council, healthcare facilities in the United States generate approximately 14,000 tons of waste daily. Between 20 and 25% of that 14,000 tons can be attributed to plastic packaging and plastic products. Much of that plastic waste ends up in landfills or is incinerated, even though 85% is non-hazardous. In response to this issue, hospital systems are focusing on waste reduction practices, including recycling. However, several barriers hinder the widespread adoption of recycling practices in healthcare settings. Many hospitals, clinics, and labs face space constraints that make it challenging to implement efficient recycling programs. Collection programs require recycling bins, central collection containers, signage, and staff training materials. Compactors may be also needed to reduce storage space requirements. Healthcare products come in diverse packaging materials and formats, necessitating sorting to optimize recycling value. This diversity complicates the recycling process and requires specialized handling techniques. The infrastructure required for sorting different types of plastics adds complexity. Recycling becomes economically viable at scale. Although the industry generates a lot of waste as a whole, that waste is decentralized. Aggregating sufficient volumes of plastic waste from healthcare facilities is a logistical challenge. Coordinated efforts between regional facilities will be essential to building the scale needed to achieve economic sustainability. Healthcare providers often face resource limitations, including time and personnel, which can detract from efforts to prioritize recycling initiatives. Recycling programs must be simplified and easy to follow to be feasible. Single-stream mixed recycling is the most viable option for providers to implement, but that requires a sortation step downstream of collection. Due to the nature of healthcare activities, there is widespread perception that plastic waste used in healthcare settings is contaminated. And that raises concerns about recycling feasibility and safety. Waste characterization studies have shown that 85% of plastic waste from healthcare settings is non-hazardous. However, traditional material recovery facilities, or MRFs, and reclaimers do not view healthcare plastics as desirable feedstocks, given that potential for contamination. Now, despite these challenges, significant strides are being made in the field of healthcare plastic recycling. Innovations in advanced recycling technologies hold promise for transforming conventionally hard-to-recycle plastics into valuable resources. These technologies take plastic waste inputs and convert them into feedstocks or intermediates to make new plastics. These technologies are more adaptable to mixed plastic waste streams, easing the burden on sortation, although sortation is not eliminated altogether. A subset of these technologies requires specific plastic types to optimize efficiency, but they are more adaptable to a diversity of formats, like flexibles. Plastic recovery facilities, or PRFs, and secondary material recovery facilities are emerging as key players in processing healthcare plastics, enabling more efficient recovery and recycling. They thrive on mining valuable recycling feedstocks from streams typically viewed as low value and not desired by conventional recyclers, such as mixed plastics. These facilities could help solve the industry's sortation and volume aggregation challenges. Advanced sorting techniques, such as automated optical sorting and AI-assisted sorting, are being developed to streamline the sortation process and enhance recycling efficiencies. These technologies can identify and sort specific material types at very high rates of speed at a material recovery facility. Now, these sortation advancements will help cost-effectively sort healthcare plastics into commodity bales. Collaborative efforts are essential to overcoming the complexities of healthcare plastic recycling. The Healthcare Plastics Recycling Council, or HPRC, is an industry consortium dedicated to advancing sustainable practices in recycling healthcare plastics. It brings together leading healthcare companies, recyclers, and suppliers to develop solutions that increase the recycling of plastic waste generated in healthcare settings. HPRC focuses on research, pilot programs, and collaboration to address the unique challenges of recycling healthcare plastics, aiming to reduce environmental impact, promote the circular economy, and drive innovation in recycling technologies and processes within the healthcare industry. HPRC has developed several tools and resources to support healthcare facilities and packaging producers in their recycling endeavors. HospiCycle is a specialized recycling toolkit curated for healthcare facilities, facilitating the safe and efficient collection of plastic waste. Design guidance for healthcare plastics recycling encourages the design of healthcare products and packaging with recycling in mind, promoting sustainability from the onset. Advanced recycling research provides the industry with technical information on how advanced recycling could be used to address healthcare plastic waste. Other notable collaborations impacting the industry's sustainability efforts include Practice Green Health and My Green Labs. So while healthcare plastic recycling faces significant challenges, ongoing technological advancements and collaboration initiatives pave the way for a more sustainable future. By addressing barriers, embracing innovative solutions, and fostering partnerships across the healthcare sector, we can collectively work towards reducing plastic waste and promoting environmental stewardship within healthcare facilities. Through these efforts, the vision of a circular economy for healthcare plastics can become a reality. In our final lesson of this course, we will pull it all together and discuss strategies that packaging professionals can use to adopt sustainable packaging practices for healthcare